recognizes the ranking member for opening statement. I yield to the ranking member for an opening statement. I yield back.
Good morning, Madam Chair.
Thank you, Madam Chairman.
Distinguished gentlelady from California, Mary Bono. Gentlelady is recognized.
Chair now recognizes
the lady from California is recognized.
I'm pleased to introduce Congresswoman Mary Bono, former U.S. Representative for California's Inland Empire and Desert Region from 1998 to 2013.
Mr. Speaker, I yield myself such time as I may consume.
Gentlelady is recognized.
Hello and welcome to Sagely Speaking. I'm your host, Mary Bono, and today we have a fantastic guest. Her name is Cammie Wolf Rice. Cammie is a philanthropist, an activist, and a speaker, and an author. And she's here to talk to us today about a lot of her great work. Unfortunately, I have to have a lot of parents on my show who are parents who've lost a loved one to an opioid overdose, an accidental overdose death. And I do it because I believe there are a lot of lessons to learn, whether it's what we should be doing differently, how we can change the trajectory of this crisis, or how we can find some strength and inspiration in people who've been through this and all that they do. Now, Cammie fits into all of these roles so beautifully. She is definitely an inspiration for what do you do to pick yourself up off the floor when you're deep in grief and actually make a difference. Cammie, welcome to Sagely Speaking, and we're honored to have you here and get to know a little bit about you. So thanks for coming on.
Thank you, Mary, so much for the opportunity to share what CWC Alliance is up to these days. And, unfortunately, as you mentioned, it's a tragedy. My son had a health crisis, and it was over 20 years ago. And it was right when Oxycontin was released as the wonder drug. And he was in the hospital, and we went home with 90 pain pills, followed by 90 more. And Mary, my son was he had such high inspiration. He wanted to be a Navy SEAL, super disciplined, AP student, just a love. And it hijacked his brain, literally. And within that first prescription, and he fought substance misuse for 14 plus years. And he lost the battle February 26, 2016. And, I was in fetal position and a zombie for 2 years because as a mother, you feel like you failed your child. It is our job to protect our children. It is our job to save our children. And I didn't even, because the stigma is such a real thing, my family didn't even know what happened. I kept so quiet because I wanted Christopher to have a respectable death. Sadly enough, I was afraid of what they would think of him as an individual, as a human being. And he was such a love, and it wasn't his fault. After 2 years, I was like, I got to do something. And that's when CWC, it's our 6th year anniversary this month.
That's big. In many ways, it's a milestone, but it also probably feels like it was only yesterday that your life was turned upside down.
Completely.
Tell us a little bit about what CWC.
Well, there's so many swim lanes to substance misuse. I was like, where am I going to be the most effective? And what I felt like in all the stays in the hospital, I felt like there's a piece to the healthcare team that's missing. And I look at it this way, Mary. If you look at our society, we have coaches for everything. Executive coaches, birthing coaches, workout coaches. Every sports team has a coach. When you're in a health crisis and you're in the hospital, you have no coach. You have nobody to be at bedside explaining to you, if you have to be on an opioid, the dangers of the opioids and how fast you need to taper off, providing other pain management techniques that are non-addictive. And what about coping skills to deal with anxiety, stress, depression, PTSD? If you're in the hospital, you might have all 4 of those things. And so really I said, let me pick the hardest thing there is to do. And that is to create a new position in hospitals. And I based it on every single thing that Christopher did not have and that I did not have as his parent and his caregiver. And so we started the Life Care Specialist program. I got to be honest, Mary, I met with over 150 medical professionals, deans of medical schools, nurses, hospital administration. And I pitched the whole idea and I said, put holes in this. What am I missing? And they said, this is needed in hospitals. Where are you going to find the money? And I said, is it just based on money? because that's what I'm going to do. I'm going to find the money. And we did. And so we started clinical trials. Our training hub and our clinical trials were started at Grady Hospital in Atlanta, Georgia. It's one of the top trauma hospitals in the country. We've been doing clinical trials since 2019. And we were able to do it all through COVID. When people couldn't see their loved ones in the hospital, they had the life care specialist. And so the data has been astonishing. 70% of the people that we saw at our initial baseline didn't know they were taking an opioid. They knew the street names for painkillers, but they didn't realize they were going to go home with an opioid. They didn't have the education. They didn't know about naloxone. And so we were able to dive right in and to really make a difference with patients when they're in that hospital. And many times, Mary, they need a listening ear. They need somebody just to vent to. And when you validate someone's pain, that helps just to know somebody's listening to you and validating your pain. The other thing I'd like to mention is because we have so much time to spend with the patient that nurses just do not have the time to do, we're uncovering other comorbidities like domestic violence, food insecurity, housing insecurity. So we're able to give them additional resources and provide resources for the family as well.
That's fantastic. How many hospitals are you in now?
So let's see here. We're at Grady. That's our training hub. We're going into Emory Hospital. We just hired for 2 life care specialists to Emory. We just received opioid settlement money in the state of Arkansas. We just launched in 2 rural hospitals in Arkansas. And we've got a huge focus on the rural hospitals because they have such a need. And that is where actually all the substance misuse started with, as you know, with Oxycontin and so forth. We're rolling out into 5 hospitals rural hospitals in Georgia as well. So we're busy.
That's fantastic. I'm glad you brought up the opioid settlement dollars. There's a lot of money there, obviously not enough to be responsible for the crisis that they created, the manufacturers and all that, and the catastrophe they unleashed on our country. But it's good to hear you say this is an example of something that works with those response dollars. And I'm curious, when you said you found the money, is that the only place you found the money for this, or did you have to go to other sources as well?
Great question. Yes. I think when I walk in a room, people go, "Oh, there's Cammie. We better run. She's going to ask for a check." And I don't apologize for that. We actually had a private foundation, the Rollins Foundation, that gave us $1 million, granted us $1 million. And that really helped us start our rural initiative. And I'll say the key has been partnerships. So we partnered with Mercer School of Medicine and their faculty. We created the curriculum for the life care specialists to become certified. And the faculty at the School of Medicine, we put together 12 modules. And so you have to go through an online curriculum. And then we do the practicum on the hospital floor at Grady. And then I bring my team into your environment, into your hospital to train on site. And then we do an ongoing support where we have a warm line where if the life care specialist gets in a situation and they need support, they have a phone number to call and we can walk them through it. I'm really hand-holding every single hospital to ensure that this position is secure and successful. And the other huge news that I'm really excited about is Harvard Business School is doing a case study on the life care specialist. And so they did all these interviews with key stakeholders and with different hospitals, and we're reviewing it, getting ready to launch. And they said, wow, I'm like, there's so much has changed in the year when you started this a year ago. And they said, well, actually, we have some really good news for you. We're going to continue doing a study with the life care specialist throughout your journey because it has changed so much ongoing. And prevention is a very difficult thing to prove in data.
Yeah. Yep.
And I'm so glad that opioid settlement money is going to treatment centers. It needs to go to good treatment centers. However, we need to allocate funding for prevention. And many, many times, addiction, substance misuse starts with a prescription. It starts with a health crisis in a hospital. We started in orthopedic trauma because young people, that's their first introduction typically. They've had a football injury, a car accident, a gymnastics injury, and they go home with a big bottle of painkillers, and it changes their whole trajectory of life.
I think another thing that's important about this and your work and the work of so many people like you, and I'd like to think me, is hopefully we're pushing innovation. That we've got to get better than here's your 17-year-old who's getting his wisdom teeth out and here are 30 days of Vicodin.
Yes.
And I'm hoping that the medical profession, it does seem that they're, of course, on board and getting this now, but it is easier. They are cheaper. They're very cheap. Insurance companies love that they're cheap, and it's easy. But with pushback, and especially whether it's with data or sometimes it's anecdotal, hopefully we are spurring on innovation to do better, whether it's non-opioid alternatives, asking for more of those. But this life care specialist is interesting. Again, it's innovation. You're pushing some innovation in a hospital. These people generally don't like innovators coming in, seems like, from the outside and telling them, hey, you could be doing this better. Is this specialist an MD, or what are their credentials prior to taking this position on?
Such an important question, because a big part of our strategy is in rural communities. And I didn't want to, and I got pushback in the beginning. I had to really fight barriers, but I can't get fired. I'm working for free. So, I'm not worried about that. So I don't take no for an answer, because really what the skill set I'm looking for, because we can train them when they go through the online and the curriculum and the practicum. I've got to have the things you're born with: empathy, compassion, non-judgmental person, a listening ear, as I said earlier. I've got to have things that I can train on the other things. And so, yes, many of them have healthcare backgrounds, are college graduates, but I also have 3 people that are in recovery that have not graduated, but they're a peer and they're able to talk to somebody in an emergency room that's had an overdose and to help get them into treatment. And so I feel like if you go through the training and you pass all the modules, you pass the practicum, then I feel comfortable to put you on a hospital floor. It's not an MD, and it doesn't need to have 4 years of student loans for this. Really, I'm looking for things that you're born with, and I can teach you the rest.
The peer is incredibly important. A strong, strong force there. I've seen that. I've seen it in action. I've seen what it can do to change or bring people along in a way that other people can't do. So congratulations on figuring out that piece. And I know you talk a lot about mental health altogether and the important piece that plays.
So yes, we're all trained with the Trauma Resource Institute. Again, another amazing partner of CWC. You can't work in silos. Partnership is the key to it all. And there is no competition. As long as people are dying, if nobody's dying, then we can talk about competing with other nonprofits. We all need to play well in this and not work in silos. I'm a big component of partnership. So we partner with the Trauma Resource Institute. We're all certified with the curriculum there. And so we can help people get control of their nervous system when they're having a panic attack, when they're having, that stress. We can give them easy, simple coping skills at bedside. We have free apps for them to download. And you were talking about innovation. We do sound therapy, aromatherapy. We're doing things that aren't typically done in the hospital. Putting on a eye mask, how the hospital has that very sterile environment, bright lights, there's people coming in and out. So we've got to get them at a peaceful place, a healing place, right? So we are always looking at innovative ways to deal with pain management. I believe that there has not been enough education in our med schools, in our nursing schools. And nurses will tell you, look, if somebody's pressing that pain button, what I have in my arsenal is an opioid. I've been trained. If your pain scale is a 7 or higher, I'm going to bring you a painkiller. If I'm lucky, I might have a heating pad. Now I call the life care specialist. And that is a quote from a nurse. And I'm like, the respite we're giving to the really, really exhausted nursing staff that we have nationwide. Nurses are tired. They're tired. They're overwhelmed. They have way too many patients per nurse. And so they really look at this as an asset to their team because they can have the LCS go in instead of giving them that pain medicine.
I want to point out, though, that advocates such as yourself, myself, and so many others, we are not advocating to remove opioids from the arsenal
No.
of physicians at all. And I believe there's a time and a place, but I also believe in policies that make sense and a medical practice that makes sense, that takes into account the risk level so much more. And I think we didn't used to do that. We're getting there. We're getting better. But I think for my listeners to know that we do not say, let's get rid of opioids altogether.
Never.
I'm the first to tell you that I've had to use them in the past decade. I broke my arm. That was not fun. And yes, I wanted my opioid painkillers. That's not what we're advocating for, but we are asking for some thoughtful responses here on what can we do. An example of this, Cammie, too, is if you have somebody in the hospital bed who is in recovery from an addiction to an opioid, you really have to think twice. Obviously, again, the physician is going to say, well, it's worth it. He needs to have these opioids and it's fine. But if we can push a little innovation along here to give some alternatives, because I've seen this. I've known somebody who has had to have some surgery and was terrified about being given opioids because this person knew they would most likely be off and running again because they loved them so much that they speak to that person's brain. But so what are the alternatives? And that started in this case with a fantastic doctor who knew and put this into the pain management plan. So this is not my typical patient. What do I need to do differently? And I think to me, and forgive me, all my listeners who are in the medical profession who are saying, Mary, you're full of it. This is anecdotal for me. This is my lived experience. This is my life experience. But I do believe pushing along innovation in that case where the doctor can say to the patient, let's figure out a plan.
It really, I'm okay with it, but it triggers me so bad, Mary, because my son had multiple times in the hospital and in the emergency department. He had his colon removed. And so he had a blockage. And so it was serious. But, I don't know if those of you who have seen Terms of Endearment, when Shirley MacLaine was screaming, give my daughter the shot. It's 11 o'clock. Give her the shot. I was that mom screaming in the emergency room, don't give him the opioids. He's in recovery. Let's look at other alternatives. And they don't know what to do. They really didn't know what to do with Christopher. And it was astonishing that, I was begging not to put him back at ground zero again or back even worse, right? And so yes, I love that you said we're not the devil. I've had many people come after me. I'm trying to take people's opioids away from chronic pain. No, but it is not a long-term sustainable plan. And I will speak out loud about that because it does have many, many side effects for long-term use. I think the prescription writing has decreased because of the databases in each state. However, let me give you an example. My husband just had a complete knee replacement. The physician there gave him 2 opioids. And I was so happy. I wanted to just squeeze him. I was like, oh my God, you only prescribed 2 opioids. And I found it very interesting. I said, what do your counterparts prescribe? And he put his head down. I said, no, tell me, because he knows what I do for a living. And he said, Cammie, they prescribe 80. So for the same surgery, you have one physician prescribing 2 and another physician prescribing 80. And I said, well, let me ask you a question. How many call you back and ask for more when you've given them 2? Only 5%. Only 5%. So yes, people deal with pain differently. Some people have a higher tolerance for pain, which I understand that, but we need to get protocols in place. If you look at HSA in New York, all they do, I call them the Home Depot for bodies. They do just knee replacements, hip replacements. They put a prescription protocol in place. And after 1 year, they had a 1 million pill reduction with one hospital. One hospital. So I still think there's, we're writing too many prescriptions. I think we're not giving enough education, and that's what the life care specialist does. We talk about locking up your medication. Many times a patient that's I had a patient say, my wife's in recovery. I had no idea I was going home with an opioid. Well, you can't go home with an open bottle access, right? If you have a loved one that is in recovery. So these are the things that it's just lack of education. And you really also teaching patients to be their own health advocates. We help them to prepare what questions to ask your doctor when your doctor's coming in to visit you. Help them to be their own health advocates across the board, not just with their pain management.
Well, before we shift gears into your book, I just wanted to ask about this. You're a brilliant businesswoman, strong, talented, motivated, driven. Let me keep going with all, all the great things you are. I would start with strong. But, when we get to this point, if the business of pharmaceutical drugs in America, we are smart enough, are we not, to know how to keep these drugs in the hands of the patients who need them, but out of the hands of our children? It seems that's the intent. That was the whole intent of all of the, the way that FDA was created and DEA and you name all the agencies. Yet that's where we failed. It's not just the patients or then the overprescribing or getting a patient addicted because they're on too many. That's one part of it. But the fact that so many of them were diverted and we had so-called systems in place, suspicious monitoring programs that people, not computers, not AI, although AI is coming into play, right? But that should have seen that one pharmacy in one certain community in Florida or West Virginia are selling, hundreds of percent, I don't even know how much more than a normal pharmacy would be, but astronomically greater. But no red lights went off. Nobody said, uh-oh, until pressure was coming on by parents who had lost a child. And so finally, this ratcheted up to that level. But for the longest time, no alarms were sounding, no bells were ringing. And that's the point. We can do better.
It's big, big, big business gone really, really, really bad. And, I had a choice when I said, I've got to do something. I've got to get out of fetal position. What do? I wanted to be in the prevention lane specifically because I want to stop it before it starts. And, again, treatment's so important. But I had lived that. I have my PhD of being a MOM in treatment centers. We tried multiple ones with Christopher. And for those of you that have a loved one that is dealing with substance misuse, please don't give up on them. Yes, have barriers, but in no way, shape, or form should you ever give up on them. Their recovery is real, but our swim lane is prevention. And, I could go on a tangent. I could do a whole podcast with you on fentanyl. I do a lot of work with the DEA. The DEA is begging for help. I don't understand. 300 kids are dying a day and we're not talking about it enough. There should be a ticker on every news channel showing how many children. I get calls weekly. Last week, it was age 14. Age 14. No child deserves to die for making a bad decision or getting something that looks like a Skittle and being told they're going to dance and party and laugh all night and they take the Skittle. Many, many people have tried different drugs throughout their lives. The difference is they're poisoned now. They are poisoned and they're killing our kids. I would love to see a movement with mothers across this country speaking out because you think it can't happen to you. And it can. Kids are overdosing in high school bathrooms, and you're like, oh my gosh, we've got the school shootings. We've got so many things that are coming at us. But fentanyl is the number one, and it's killing our military age. Largest killer, ages 18 to 45. And so, the DEA said to me, if we went to combat with another country, we would win in less than 30 days. But the issue is they're killing our kids every single day and not one bullet's being shot. It's all fentanyl. And it's not just coming around the south border. It's coming around all of our borders. And we need to be speaking out about it. And I know it's a big part of the election. I'm not trying to get political. The bottom line is, look at the numbers. We have to wake up and have conversations. And I personally don't think it should be, it's up to you with what kind of relationship you have with your children. But it may not be the mom or the dad's place to have this conversation. It might be a cool aunt or a neighbor or a football coach, somebody that they respect and they're going to listen to. We train a lot of youth through Usher's charity and through the Boys and Girls Club because we want it to be youth training youth telling youth about it. Then it's more cool, it's more hip, it's more believable, it's more understandable because it is true and it's a fact. If you're going to take something off the street, even a vape, even one try of a joint, there is fentanyl, and we have young kids that are dying because of it. So it's devastating.
You're right. It has changed entirely. And the threat has gotten so much worse, and it is an international threat. I talked about this with Hal Rogers a little bit ago, Congressman Hal Rogers, and we touched on some of this, but it is a huge threat. It's one of the biggest threats that I can remember. that is it's international in scope, yet it is as important at the kitchen table as it is in any diplomatic circles. Or in any military planning, that the threat is that real. It is driven internationally, but it goes right down to the kitchen table and to that conversation between a trusted person, a beloved person, an admired person. And I think Usher, you're chairman of the board of Usher's Foundation. And what about a great experience and great opportunity to reach people that might not be reached otherwise? We'll continue with our interview in a moment, but first I'd like to thank my sponsors. Lucy Pet Foods is the leader in gut health. Their formulas for life feature prebiotic, balanced fiber that nourishes your dog and cat's total health. Every purchase helps support the Lucy Pet Foundation, a 501c3 charity helping animals. Save 15% off your first order and use the promo code SAGELYSPEAKING, all one word, and you will get free shipping at lucypetfoods.com. If you're committed to tackling the opioid and addiction crises, then you need to be at the 2025 RX Summit. Use code SAGELY, that's SAGELY, for an extra $100 off. Join top experts and professionals as we share strategies for prevention, deflection, treatment, and recovery. Don't miss this chance to be part of the change. Head over to rx-summit.com to register now. That's rx-summit.com for an additional $100 off. Mothers for Awareness and Prevention of Drug Abuse, driving solutions to prevent drug abuse and overdose deaths by focusing on prevention through education and awareness. And now, back to our interview. What does Usher's Foundation do, and what are you doing with that? You just touched on some of it, but tell us a little bit more.
Yes. So I've been on the board since 2009. I'm now chairing the board, and we empower youth, and we have a program that starts in middle school, goes through high school, into college, into the workforce, and then they become alumni. I don't know any other organization that stays with a youth that whole trajectory of life. We help them identify their spark, and then we tie that to the workforce. This is what you're excited about. Let's show you the jobs, right, that could tie into what your spark is. And then a part of that is a healthcare component. And that's where we bring in the fentanyl education, educating them about diabetes and other things as well. But it's really giving them a voice. And I can't even tell you how much joy that brings to me, is to work with youth and to see them now. The kids I started with back in 2009, they now own their own homes. They're contributing members to society. And a huge component to our program is service. So they learn service starting in middle school. We get them involved in service projects. And so now, you get your return on your investment because you see these kids that are now grown up, big adult jobs, and they're giving back to their community. And that's what we do, one child at a time. Just like with CWC, we do one patient at a time. And you can't look at the big overwhelmness of there's a gap with 25 million youth that don't have after-school programming, Mary. And we wonder why they get in trouble. No one wants to touch those teenage years. Why? Because it's complicated when you're a teenager, right? Nobody wants to touch that. And that's really where our sweet spot is with A New Look, is the teenagers and keeping them engaged. So thank you for asking about that. And we're celebrating fantastic. 25 years this year.
That is amazing.
Yeah.
Let's go to your book. Okay, so you weren't busy enough. So I'm just going to sit down and write a book. Tell us about book writing experience and how that's going and the feedback you're getting on it.
Thank you. I never thought in a million years, Mary, I would be an author, because I'm not a writer. I got some help on it, and I put his name on the book, and he's like, Cammie, they're called ghostwriters for a reason. I said, I don't care. I'm not doing this to get credit. I'm doing this to hit masses. That's why I wrote the book. And it's called The Flight. There it is. It's a flight. I use the analogy of an airplane because I spent a lot of time on planes. We used to live in Hong Kong, so I spent a lot of time on planes. And people leave our flight unexpectedly, as we know, Mary. And people join our flight unexpectedly. And everybody, we land at different places in our life. We land at success and happiness and family and joy and sorrow and sickness and grief. We land at all these different places in life. And how do we keep refueling? And, I will just say, I felt like I wrote about my journey with my son, but I promise you this book was written for you to think about your own journey, for you to think about your own life. And I put QR codes after every chapter. Some people don't like to read. You can scan and there's a little video. And then I have a QR code in the back with a resource library, a music list, a playlist, apps that you can use. And I can constantly keep that updated. It'll never go stagnant because it's a QR code. And so I really felt like I wanted to reach the masses. That was the whole purpose of the book. I'm super proud of it. A higher power took over. That's what I will just say of this book. And so, yeah, I thank you for that. And I really think it's helped a lot of people get through things. I've had some interesting people like come up and say, I'm starting a bakery because I read your book. And I was like, what? You didn't lose a child. It has nothing to do with death. It has nothing to do with grief. She said, no, you inspired me, right? And so what I will say in summary to the book is, look, I would not be doing well if I did not have CWC, if I did not have all the philanthropic things that I do in my life that feed my heart and my soul, because I miss my son. His heavenly birthday is Wednesday. And there's not a second, Mary, that I don't want him back. And I know that if he would have had a life care specialist, if I would have had a life care specialist, he'd still be here. My kid is dead. I can't get my kid back. I am out to save your child. Anybody's child, anybody that will listen to me, I am sounding that alarm. I want to save lives. I want to save parents from burying their children. And so having that purpose, it sounds so cliche. People say, oh, you got to have purpose. That is the key to surviving grief, is having purpose. And it doesn't have to be starting a nonprofit, writing a book. It could be crocheting bonnets for the NICU babies at the hospital. It could be taking dogs at a volunteer shelter on dog walks. It's feeling any kind of purpose in your life is the only solution, I feel, and having that connection of love. Without that, I wouldn't be doing what I'm doing. I wouldn't be doing as well, honestly.
Wow.
Yeah.
Ugh.
Yeah, and the other thing I'll say, and again, I even stutter when I start to say it, because again, I go back to stigma. There's so much stigma around all this, and it's a disease. We don't give trouble to somebody that is a diabetic and they ate 3 candy bars and they're in the hospital. We don't say, nah, sorry, we're not going to help you because you ate 3 candy bars. Addiction is a disease, and there is usually a root cause of what caused. There's usually an underlying trauma that's happened and some people can take an opioid and they're fine. They don't want to get off of it. They don't. And other people, it attaches to their brain and it hijacks their brain. So if we could just understand that silence is deadly, if we could reach out as a community and love each other. I had to hide Christopher's substance misuse. I didn't have the support had he had cancer and moms were bringing me casseroles because nobody knew, because I didn't want them to think bad. And I didn't want him to think bad as me as a parent, right? But he had nothing to do with that, and neither did I. So I think the key is just to talk loud about it. And where I was going with this is in COVID, my brother, 53 years old, and a friend stopped through Florida. He was in Orlando, and he was just stressed out just because of COVID, and he was been by himself, and gave him a Xanax, had fentanyl in it, and it killed my brother. So I understand my assignment very, very clear. And I am not going to stop until I have life care specialists in every hospital across this country, until that alarm is heard and people get naloxone so that they can have it in their car, have it at their house, so that they can save a life if someone has been poisoned or is overdosed. I get my assignment, and I do this 24/7. And yeah, I'm tired, and I don't like to talk about my son and my brother dying every day. But if it saves a life, if one person that hears this podcast, I'm good.
I know how you feel. And I do believe that there's a calling into this because we know it's preventable and reversible if we work hard enough, if we raise the awareness, if people like you and me and others take off the ugly cloak of stigma and shame and come out of the shadows and talk about this and normalize it. There's a huge part of that. But I'm gonna ask you a question that you're gonna probably answer very quickly. And either you're gonna appreciate the question or be very angry at me. Have you ever considered running for office?
You're asking me?
Yes. You would be amazing in office. And I'm saying you'd be angry at me because I don't wish that upon anybody any longer. But my God, your energy, your passion, your knowledge, you would be fantastic. Have you thought about it, or can we draft you to run for something?
Oh, that's so funny. I have not thought about it, Mary. I have not. I do think a lot about policy change and things that I would like legislators and, people to hear. I just listened to a couple of women in politics speak last week, and I'm just trying to feed them information behind the scenes about fentanyl and educating and all of that. I don't know. I'm walking my path and going wherever it takes me. And if it's saving lives and it helps people, then that's what I'm about. That is what I'm about. I have not thought about it. It seems pretty disastrous right now. It seems pretty complicated and scary. Mary, you would be the one that would have to, you've got the experience there,
I got the experience to run your campaign, for sure.
What about you? You stated it.
I did my time. But you know what bothers me is there's none of this passion for this issue on the national level. You're not hearing it out of the White House. You're not hearing, and I'm not trying to get political. I'm saying this White House or any White House, truly. We are not hearing it out of Department of Justice. I think DEA does their best, for sure. You're not hearing it out of ONDCP. They do their best, but there's no passion and outrage and impetus on drive on getting this done. And that's what you have. And I wish I could bottle some of that and share it with folks who need that, because this is the kind of leadership we need. Yeah.
It means so much. You know what I think about all the time, though, is when I first went to my first government meeting, somebody pulled me aside, not in the government, and they pulled me aside and they said, listen, this isn't going to be fixed by our government. This is going to be fixed by private sector. If you look at AIDS, what started it was the mom in Indiana with Ryan. If you look at Mothers Against Drunk Driving, you've got to keep speaking. You've got to keep shouting out. You've got to keep going, Cammie. And I'm like, okay. And I took that to heart, honestly. I really took that to heart. I don't know, but what I think is if moms would get on a mission and pull together and support, I think moms on a mission would be huge. If there was a way to mobilize mothers around this fentanyl, that to me could probably make the bigger impact than anything else is, to really wake up America on what's going on with the fentanyl. It's terrifying to me and it makes me angry. And I don't want to sound like I'm losing my mind and, oh God, there's Cammie going off again, right? It's literally you would not believe the amount of calls that I get of kids, and it's bad. It's bad, Mary.
Oh,
it's
I know.
Really so yeah, I don't know if there's ways to mobilize. Politics scares me, if I'm being honest. But if I could change some policies and some legislation or whatever, I just definitely want to be heard for sure.
Well, I'm happy to help with all that, but I do just want to end on this fact that I appreciate the mobilizing moms or parents. I think, I run a small nonprofit, Mothers Against Prescription Drug Abuse, which is, morphed into fentanyl and other illicit drugs and all. But it's fathers too. And,
yes.
And I don't want to leave them out, but this is the thing. And I do want to say, yes, parents. However, there's a huge governmental role here, because parents are not going to stop China from manufacturing and exporting this poison. Parents are not going to stand at the border and prevent it from coming in. But yes, parents can hold their elected officials accountable to do more than they have been doing. And I think that we've seen some of that, but we need a whole lot more. So Cammie, you are such a delight and so wonderful to have on Sagely Speaking. I hope you'll come back. And if you want to talk solely about fentanyl or any other topic, we'd love to have you back. Or it'd be fun to just brainstorm on policy changes that we need to see. How do we spur innovation?
And see how our charities can complement each other too, as well. I mean, I agree. I don't want to leave dads out either. We love you, all the parents out there for sure, and aunts and uncles, and all of that. It takes a village. That is a saying for a reason, right? Because it does take a village. So I would definitely love to give you an update. I think it's going to be really interesting, the program evaluation data we're going to get out of all these rural hospitals, right? And even in the urban hospitals. But I think we're going to have some pretty significant data to really prove what's going on in our country and why it's so important to educate and prevent. So yes, thank you so very much for this opportunity and platform, Mary, and thank you for every single thing that you do too.
Well,
I mean, I've connected with you day one, so thank you for that. I appreciate it.
Well, thank you. I think sometimes, hopefully, we give some wind beneath each other's wings at times when we need it most and say that it matters. And I will say, because of this podcast, I've had that moment you talked about, saving one life. not in saving one life, but I've had a parent and a grandparent, so a couple of examples of people who now say they have their teenage children carry Narcan with them, not because they feel their kids are partying with opioids, but because they feel their kids or grandkids might be in a position to save a life of some other child who is. And I felt, wow, this podcast is worth it.
That's it. That is totally it. That is totally it. I think that, you know what we're doing this Wednesday on September 18th, we are, and you might have to edit this out if it's going later, but Christopher's heavenly birthday is Wednesday, and he would have been 41 years old. And we're doing a global purple campaign, getting everyone to post purple in honor of their loved ones, in honor of my son's heavenly birthday. If anybody that's been fentanyl poisoned, overdose, dealing with substance misuse, I've got Hong Kong involved, and Italy, and all across the country. And so we're really trying to bring awareness to it because it is Recovery Month, to our purple campaign. So I hope that people will follow CWC Alliance. We spend a lot of time putting a lot of things on social media, and our website is CWC, and the flight is at Amazon for sales as well. Had to do the commercial.
Absolutely. I appreciate that, because else I was going to have to do it for you. So thank you. Thank you for doing it. But Cammie, thank you so much for being here and for all you do. We just love you and look forward to having you back on soon, whenever you can be back. To my listeners, thank you very much for being here for this fantastic episode. To my sponsors, thank you. Without you, we could not do what we do. So until we meet again, be well.